Good evening and welcome to tonight's webinar, Keeping Your Practice COVID Safe. Firstly, I'd like to recognise the traditional custodians of the land and sea on which we live and work and pay our respects to elders past and present. Emily, if you'd just like to move to the next slide, thanks. Just some housekeeping matters to begin with. For those of you not too familiar with the Zoom platform, your control panel is located at the bottom of the presentation screen. If you cannot see your control panel, hover your cursor over the bottom of the screen and it will appear. We've put everyone on mute to ensure learning will not be disrupted by background noise. Please chat to us and send us your questions using the Q&A box. We will try to address questions at the end of the presentation. It is now my pleasure to introduce to you our presenters for tonight's session. Dr. Emily Kirkpatrick is an Adelaide GP with additional public health training, working as a Deputy Chief Public Health Officer at SA Health. Emily has a background in public health, preventative health and screening. Her secondary role at SA Health has been as the Medical Advisor for Primary Care, and she is keen to keep general practice involved in the COVID-19 response. Emily is also Deputy Chair of the RACGP SANNT Faculty and Chair of the RACGP SANNT Education and Training Committee. Pushiba Thavarajadeva has been a practice manager, practice owner of Mawson Lakes Healthcare, Ingle Farm Family Practice, Tusmore Avenue Surgery and Glenelg South Medical Centre for the last 11 years. He has 10 years experience in the corporate sector, working in telecommunications and finance, and is a qualified engineer. I will now hand over to Emily to commence the presentation.
Wonderful, thanks Elaine. So very excited to be here tonight to talk about COVID safe practices. I think this is something we're all very keen to learn, how we can make sure that our GP clinics are meeting everyone's needs and we're not getting infected with COVID. And great that we've had 0 cases here in the state currently. So learning outcomes for tonight. First of all, we want to just give some background on where we're at with the SA Health and NT Health regulations and directions, particularly in relation to COVID safe environments and how that affects healthcare facilities and aged care facilities. Talk through effective infection prevention and control measures. And finally, around procedures that GPs can apply, practice staff, and practice managers and practice nurses can ensure that personal health and safety is maintained in a COVID-friendly environment. So first of all, I'll talk about the COVID risks. So this is just on the top, you can see that photo there of protecting our healthcare workers. At the beginning of the week, or last week, the Victorian government released the findings, the early findings from their healthcare workers. And so there was quite a few concerns around healthcare workers being particularly acquiring COVID within the workplace. So 77% of the infections that they've identified and gone back through and traced have worked out in healthcare workers. They've actually identified it in the workplace, not in the community. So initially it was thought that a lot of the infections for healthcare workers were in the community. In fact, the evidence has shown it's been in the workplace. So there really is this ongoing threat of COVID, and we talk a lot about the suppression versus the elimination strategy. And certainly here in South Australia, and ultimately we've realised in Australia, we are going for an elimination strategy because it's very difficult to suppress community transmission. There is this ongoing threat of COVID, and we know that this is going to continue for some time. So it's so important with practices, and particularly for GPs, that we do have long-term plans of how we're going to manage potential waves that we get in the future, potential cases, and the ongoing anxiety that we can see in our patients. In terms of where we're at with interstate, we know Queensland has identified some areas that they are concerned about, and we do still have that open border with Queensland. So what that means is that there's been a whole list of places that Queensland Health has put up online of where they're concerned that there has been some cases there. And in fact, they've been so specific, they've narrowed it down to half-hour time intervals. So at this stage, we've got no restrictions on our border and no restriction on healthcare workers as well who have been in Queensland, then coming back and working within our SA Health facilities. And the same advice we'd give out to general practice unless they have visited one of these healthcare facilities. And it is very reassuring in Queensland that they have been able to identify the links and being able to trace it back to their correctional facility, which has been really helpful to know that there's been no unknown epidemiological links there. So in terms of lessons learnt from Victoria, we do know that there were significant infections in healthcare workers, and particularly around PPE not being adequate is something that will certainly emerge over time. So we're very keen to make sure that GPs both have the infrastructure in place and PPE available. So AHPPC is still, this was a statement that came out quite some time ago, I think back in April, around, March, 30th of March, right in front of my eyes, around vulnerable workers. And so it's really important, if you do have people who are working in your practice or you yourselves meet one of the criteria here, that you do give extra consideration about how you can protect yourself in the workplace. So just in terms of an SA update, we have the public activities direction here in South Australia. Now that does not apply for healthcare facilities. We often get asked questions to say, do I need to be, doing the 1 per 2 metre square, the 1 per 4 metre square back when we had that? No, you don't. So healthcare facilities are exempt from that direction. It's only regarding public activities. But it is really important that you do try and maintain physical distancing where possible, and think about your spacing in the waiting room is so important, and where you're spacing your chair in your consulting room as well. And I know Prashiva is going to go through that with some fabulous photos that have come through from all of you out there. COVID marshal training was something that was released 2 weeks ago. There is no requirement in general practice to have it, but I would strongly suggest that you practice staff do undertake the training for the marshal training. It's quite a low level of training, in the sense that generally we're doing a lot more higher level things in general practice anyway from an infection control perspective, but it is quite useful just to go through the training, because it does just remind you of some of the directions that are incorporated into there, and thinking about just things that you might do, particularly with your tea rooms, for instance, or lunchrooms. COVID safe plans, again, no requirement in general practice to have COVID safe plans, but you can do it. There's a form online, you can fill it out, and it is quite useful, particularly if you do want to think about how your practice is functioning in the public spaces. So if you're in an area where you've got shops around, you're in a shopping centre, just have a think about that in terms of toilet access as well for staff. Now, the final one is aged care restrictions. Just a quick update on that. So those restrictions came into effect a couple of weeks ago, and then the PPE one came in last week. And the PPE one is for any workers who are working less than 1.5 metres from a resident in an aged care facility. They need to be wearing a surgical mask when doing that, and that's come in as part of the direction. Now, people say, why? Why would you bring that in when there's no community transmission and 0 active cases? Isn't that a waste of PPE? Those comments have been coming through thick and fast. In fact, there's a lot of rationale behind it. The first is we know that a number of workers don't wear PPE correctly, so it's getting used to that focus of wearing a mask. The second is it's also making sure that if you are wearing a mask, that you are wearing it correctly, and it's getting the resident familiar as well with how you are fitting your PPE as well. The other one that came in with aged care restrictions was the for personal care workers as well, only working at one site. Now that has proved quite difficult for some rural regional facilities, but it is really important to try and work how we can maintain a sustainable workforce going forward. So you can see there's the COVID marshal training link there as well. So I do encourage you to check it out, particularly because it is quite useful, and it'd be great to get numbers over 100,000 here in the state. So NT update now, because I know some of you are up in the Northern Territory. So the Chief Health Officer in the Northern Territory, Hugh Heggie, sets the directions because they're under their Public and Environmental Health Act, whereas ours here in South Australia are actually through the Police Commissioner. So in the Northern Territory, it's hotspot-based directions. So that means that it's essentially where have you travelled from. If you've travelled from Victoria, we know you have to undertake mandatory hotel quarantine. But there's actually not that many restrictions in the Northern Territory anymore, and particularly no restrictions around healthcare facilities, similar to here in South Australia. Now, there are aged care restrictions still in the NT in terms of visitors coming in, so the temperature checks on arrival, limiting it to number of visitors who can come in, so up to 2 visitors per day coming in the Northern Territory. We're not expecting any change in the Northern Territory restrictions, and certainly they have moved to a hotspot model as well, which is working quite well for them in the state. We are aware of people from Victoria who do go up to the Northern Territory to undertake their 2 weeks of quarantine and then come into South Australia, noting we have that hard border. So although they have mandatory hotel quarantine, the border is effectively still open in the Northern Territory. So just quickly around risk mitigation, so I don't ramble on too much. Social distancing, so important in the tea rooms in particular. That's been identified in a number of Victorian aged care facilities. The tea rooms were a source of transmission. So it is really important that you do think about your tea room setup. I know we're so focused on the waiting room, the consult rooms, but think about all those congregating staff areas, staggering times as well when people all get together in those spaces, and making sure we're maintaining social distancing. Working in clinical teams, I was at a practice in the city that had a great system around bubbles. So we had 2 different teams who worked different weeks. Of course, sadly not there. I'm here now at SA Health, but it is really important to think about how you would structure and give some thought around this, particularly if we do have a second wave. And I know many of you already have sort of gone through that process of how you split up your clean team, your respiratory team, your pregnancy teams, all of those. But try and minimise all that ongoing staff interaction as much as we love Friday night drinks. And risk mitigation as well. The clinical teams is really important, but think about your buddying systems as well and how you can divide up when you talk about your risk matrix, especially around those paediatric pregnant women contact as well, and how you can do that. So the future, I think we're going to be seeing a lot more of these green stickers everywhere, the maximum capacity. Think about doing this for your waiting room. It's just a useful exercise to measure it out, work out how many people you can fit per square metre. So 1.2 metres square for your waiting room is really important. And we know how important it is as well about monitoring the entrance as well, having signs up, and you'll see some great photos coming up soon. So measures going forward, we're obviously going to keep the 1.5 metres in. That is going to be in for a very long period of time, really. It's something that we'll just have to continue thinking about how we space out, particularly as we know the virus is so transmissible. Limiting the number of staff and workers in the same vehicle if you're going out doing community visits. And the other area as well as sanitation stations as well. So making sure that you've got, coming in easy access to a hand gel and things like that. And I saw Adelaide PHN have got another offer on hand gel as well. So if you can't access any, just check that out. That came in their recent update. Screening, just a quick mention on screening. This has just been taken from the SA Health LHN screening. I put these here, you can screenshot these and take these out later. It's just useful to think about. We've got the questions in there now about Queensland in our screening. And the concierge questions that's talked about at LHN. So, have you been unwell? All of those questions been to particular areas and around SAPOL as well. Do you have a SAPOL clearance to be here? And this is a great little fact sheet as well about essential travellers. So you can go back through, have a look at these slides later. In Broken Hill, always get asked about poor Broken Hill. It's a bit unfortunate, isn't it? Just over the New South Wales border, but of course, most people in Broken Hill think of themselves as South Australians accessing most of their healthcare here, really, if they need tertiary level care. So, we are absolutely still allowing people from Broken Hill to come in for medical care, and also allowing medical practitioners to go to Broken Hill and not require to isolate when they come home. PPE update. Now, this is just put in here, which is really exciting. This will come out in our new PPE matrix, which hopefully will be released very soon, end of the week, early next week. Now, this is because of the fact that we have seen those increased numbers of infections in Victoria. So think about your PPE, what you're doing. There's been a lot of talk around when to use N95s. If you are doing repeat swabbing in your clinic, the advice really is that you should be wearing an N95. If you're wearing it for more than one swab in a row, prolonged periods of swabbing, particularly for COVID clinics, we've done it as advised as well for the pharmacy testing, and also for the drive-through clinics. So think about that. But it is really important for fit testing. So there are a couple of places that do fit testing. The University of Adelaide in their SimLab has a fit testing machine. There's also a private provider in North Adelaide, and SA Health is, if there is enough interest, we could absolutely look at doing that through us here as well. But it is something to think about. We are getting more and more supply of the Detmold D95s. They call them the PFRs. So it is really important to think about your PPE. So I'm going to hand over now to Prashiva. I think I've talked enough. So all yours.
Thank you, Dr. Emily, and apologies if I repeat anything that Dr. Emily said. I'm going to be talking about a lot about the practice and the patient journey here. Firstly, thanks to the practices for providing the photos that appear in these slides. This slide is about the resources that are currently available. We all know that the RACGP has got a pandemic planning toolkit available, so it's a suggestion for your practices to look at. Next slide, please. The other resources that the RACGP have is the infection control principles, so looking at how to keep your practice safe, and donning and doffing equipment in terms of masks, on gowns. So there's a lot of resources around that the RACGP have provided. And finally, in this slide, there is the keeping the practice COVID safe checklist. Maybe a suggestion at your next clinical meeting to go through the checklist there. So we're going to be having a discussion around or talking about the patient journey. And some of these are things that we have done in our practice, but some are also is around the thinking around how you keep your GPs, your nurses, and your frontline staff, your receptionists, safe. So we're going to be talking about the pre-consult questionnaire. And so we're going to be following the patient through from the time they make the appointment. So one of the suggestions is how to explain the changes within your practice. When we first had the pandemic, we all, took away our chairs, locked the doors, put signs out. So communicating this to your patient base. One suggestion is a lot of your practices already do reminders, SMS reminders for your patients before they come for their appointment the day before. So suggestion is create a website link and add that link to the SMS. And when you send out the reminders, they could click on that link and they know when they arrive for their consult, they have to wait in the car, or if they have to, the doctor will call at the time of the appointment and then walk into the practice. So you limit that risk to your staff as well. Also, when confirming long appointments, it'll be a suggestion to let the patients know the process. A lot of the online bookings now have a pre-consult questionnaire or pre-booking questionnaire. It's the ability to put your messages on your online booking system as well. One of the suggestions is also let your patients know that they don't have to call if they're coming into and waiting in the car park. They could just arrive, and at the time of the appointment, they'll be called into the practice. Next slide. So these are some more resources. So promoting a COVID safe app to your staff and your patients is a suggestion. The other resource to have maybe on your website is getting the best out of your phone or video consultations with your GP. This is an information slide. The other suggestion is also the resources around looking for symptoms on the right-hand side of the slides, looking at the symptoms for COVID. And so you're building that awareness with your patients. Next slide. So all of our practices, when the pandemic hit, we put up signages, sanitizing stations. So we put up stop signs. So a bit more nicer one is a wait sign. There's the automatic hand sanitizers. There is, I guess, online booking appointments or apps that can do geolocating. So basically when you come to your practice, if you're within a certain area of your practice, you can check into the waiting room automatically. But we suggest to our patients when the pandemic first hit that they're waiting in the car till they are brought into the practice or have a telehealth consult. One of the other suggestions is encourage your patients to limit the number of people attending the appointments. If they have a large family, just suggest 1 or 2 people from that family. If they want other people to be part of that consult, maybe give a call on their mobile phone and have them on loudspeaker while the other family members are in the room. Next slide. So we're talking about the concierge desk here, the reception concierge. At this practice, there's a receptionist that takes in all the patients, so checks in all the patients. Any other family members, they will have to check in as well. Any of the deliveries, all handed right here. So you limit the infection within the practice and limit the number of people coming into the practice. Even the couriers will have to pick up all the pathology from the concierge. Next slide. So we're looking at the waiting room, and here in the waiting room, ideally, we all have automatic entrance doors, but not all of us are that lucky. So suggesting if you do have the ability to have an alternate entrance or waiting area for your more high-risk infectious people. Once the pandemic did start, we all minimize the number of seats and chairs within our practices. So that's about social distancing. We removed a lot of the touch screens. So once the pandemic hit, it's all about making sure we've got a safe, risk-free environment as much as possible. So we'll decommission a lot of the touch screens. We installed, Rob, my business partner, installed these sneeze guards, the acrylic sneeze guards that you'll see in some of the subsequent photos. These have been wonderful and the front desk staff love them. It protects against the aerosols. In the waiting room, potentially suggestions is remove or minimize a lot of your brochures, your toys, obviously coloring in books, and have a regular wiping down regime. Next slide. So like this practice, the front counter is completely bare. There's markings on the floor to show patients 1.5 meters from the front desk. One suggestion is the outdoor waiting room. If the weather's great and you have the ability to have chairs outside and socially distance, probably suggest for those patients that do want to wait outside or for the elderly and frail, you could give them the outdoor waiting room. Again, it has to be done safely, so you should be able to see the patients. During the pandemic, a lot of our practices, and your practices included, have really developed a lot of different ways of doing the flu season, the drive-through flu jab. I'm sure I've heard many of practice do that. So these are wonderful, innovative ways that you have, I guess, adapted to the pandemic. Next slide. I was newest member of our practice team. You'd be surprised how many times this member has been called on. One of the downsides of having an outdoor waiting area. At the reception desk, we'll try to minimize the transfer of paper between staff and patients at the time. So bulk billing, signing bulk billing claim forms has been put aside during the pandemic. Identifying social distancing. If your receptionist, if one of your receptionists can be at the front counter, the other one can be taking phone calls in another room or processing the billings. That way you can limit the number of people in the waiting room. Again, removing unnecessary items from your reception desk, and the ability to send secure emails for patients or emailing patients the information around certificates, results, path and radiology forms so that you avoid patients coming into your practice and picking them up. Next slide, please. So the FPOS terminal does work through the sneeze guards as well. And so the sneeze guards went to Bunnings and Rob bought all the gear and installed in the practice. Next slide. Some of the processes to consider is for both telephone and video consult is encouraging patients to do more online booking. The new patient forms, if you can get as much of the patient details over the phone, will be a suggestion. The other one is if you email the patients the new patient form or have a link on your website, they could download and fill in most of the forms before they come into the clinic. The other option is some clinical softwares and some online platforms now offer new patient forms that patients can securely enter their information and it will be coming into your clinical software. Standardizing the COVID-safe questions throughout the practice. We know it keeps changing, but one of the ways is, making sure that all your front desk staff have a clear guidelines, and Dr. Emily showed you some of the flow charts around that. We know that patients sometimes don't always tell the truth when they come into your waiting room. So one suggestion is train your front desk staff to say, if they've got a gut feeling that, they may not be as well as they are, provide them a mask and give the doctors a heads up. So keeping your GPs and your staff safe as well. Next slide. So again, with the processes that you can incorporate around video and phone consults is faxing the scripts directly to a chemist or e-scripts is coming in the near future, I'm sure. but the ability to making sure you limit the number of patients coming in to picking up their scripts or referrals or sick certificates. We talked about social distancing, like this webinar, there's Zoom, so it's a wonderful tool. So if your practice staff are at home, they could still Zoom into clinical meetings or meetings at your practice. And again, if your meeting rooms are small, they could Zoom in from another room as well. We know that PPE, and this is about clinic security and making sure you have enough PPE stocks and keeping them safe. We know that PPE is valuable, so therefore making sure it's in a locked room and making sure that limit the number of access. I know early on we were all struggling to get PPE, so I've got to thank Dr. Alvin Chua, who collaborated with a few practices to get us a big stock of PPE as well. Next slide. The consult room here is the most important part of the GP's world. So we suggest having a lot of hand sanitizers, get ViroClean in the spray bottles so they could disinfect regularly, making sure there's adequate gloves and blue sheets. We know that they're going to be using a lot more gloves. The other thing is having a regime of making sure you wipe down keyboards, mouse, and the desk. It gets frequently used, and making sure there's an increased cleaning regime in the practice. Again, putting the chairs equally spaced and also as far apart from the practitioner as possible. Next slide. So one concept we suggest is having an acute care doctor. This is the sick doctor. They see most of the infectious patients and do a lot more of the phone consults with their usual patients. Another doctor may do see all the pregnancy or shared care patients. So this doctor predominantly is for those fairly well patients. One of our doctors just had a child, so to keep their family safe and children, they became the vaccination doctor as well. Next slide, please. So with the consulting rooms and encouraging patients, when you're talking on doing a lot more phone or video consults, one suggestion is emailing the patients their pathology form, or if you have an in-house pathology nurse, providing the pathology nurse with the form, so then you let the patients know that they could come in, have the test done, the forms are ready, and the doctor's already signed potentially on behalf of the patient as well, so then there's less chance of risk of infection, and any results will be followed up by a phone appointment. The other factor is in this slide is making sure with a lot of patients that do have a COVID test, being liberal is a suggestion with your sick certificates, give them enough time. We know that sometimes it does take a bit longer for the results for COVID testing to come through as well. Next slide, please. So these are some pictures and I'll quickly walk through them. A sneeze guard screen and distancing in a consulting room. On the left-hand side, on the right is the waiting area for a respiratory clinic. Again, a lot of the waiting room, the chairs have been removed. It's basic bare bones waiting area. Next slide. So on the left-hand side is one of the consulting rooms at a respiratory clinic. Again, the room has been stripped of all its fittings, so to speak. And so if a GP or the nurse needs to come in, examine, they could speak to the patient, limit the face-to-face contact. They're in full PPE gear. And again, it's easier to clean down if there is a positive case. So then we know that we're going to have to deep clean that room. Then it's easier for us to do so if there's not many pieces of equipment in there. There's a separate exit for all the patients to leave as well. So that reduces the cross-mingling of people. Next slide. Again, with the nurses' treatment room, we know it's harder to physically distance if they're doing face-to-face in a practice. One of the suggestions is wearing scrubs while they're in the clinic. The other suggestion is minimizing the tasks. So if you've done your heights, weights, percentiles in the last 2 years, then suggest that don't have to do that as regularly. One of the suggestions is also increasing the use of the My Health Record or the online immunization registry. So promote e-health to your patients, so tell them they could have access to it. It's also important for if they want access to aged care facilities as well. The other factor is some clinics are doing spirometry again, so potentially have the spiral filters when you do that and provide enough masks and gloves and PPE for those patients as well. Next slide. Here for the nurses, we've all had to adapt very quickly to doing chronic disease over the phone, so which is a great thing, and telehealth has been wonderful for general practice. One of the suggestions is creating a resource page on your website where patients can download the questionnaire. So for example, if the nurse has to go with the asthma symptom score, they could direct the patients to the website, they could download the PDF and again, verbalize the response to the nurses. It works just as well for GPs. So if the GPs have to do a mental health plan, the GP can direct the patients on a phone or video consult. And again, the patient could do the -21. They could verbalize the response back to the GP, and the GP can record that in the progress notes. Next slide, please. So GPs, GPMPs, don't forget to bill the 10997 for phone consults. We know health assessments, you can't bill for it. There's no item number, but if it can be done over the phone safely, can do so and potentially bill 10997. One of the things that one of our clinics, we've been part of the Healthcare Homes trial. So a lot of the learnings that we have here is being developed 12 months prior to the pandemic. So we were able to do phone consults, email consults, develop a lot of the care planning over the phone. So it's a matter of, I guess, adapting to the current conditions. Next slide, please. For the pathology, if you have an in-house pathology, suggest using an outdoor waiting area if it's possible and safe to do so. Again, the doctors could sign the forms on behalf of the patient to minimize the infection risk, or email the form to the patients so that they could come in at their own time and have it ready with them. Next slide, please. So these are suggestions of things to think about if things do change, the conditions change. So scrubs and masks for all your staff will be a suggestion if that's possible. Another suggestion is make sure the staff know that shower when they reach home after their day at work. Remote access for GPs, that if your GPs need to isolate or your staff need to isolate, then they can have remote access and work from home. One of the fears is complacency is creeping in within our own practices, but with patients, and frustrations around a lot of these changes, but making sure that we reiterate the need for social distancing, hand sanitizing. So the other factor is using Facebook to communicate with your patients, a lot of these changes. So you can send the information around your practice policies, about good health and hygiene, and also about mental health and well-being to your patients as well. Next slide. Now we're still learning social distancing on the slide on the left, but some of our staff from a respiratory clinic, and on the right, them donning their gear. So keeping them safe and making sure they have a safe work environment to work in. Next slide. As part of the RACGP, they have, as part of the pandemic planning toolkit, you've got the business continuity. It's something to consider with your practice team and your management team about if there's any changes to the current conditions. Now, as frontline health staff, your GPs, your nurses, your front desk staff, think about your psychological PPE. That's your promote your health and well-being within your practice. With the Facebook, it's another way of getting general public information out there to your patient base. Next slide, please. Some of the things to consider, and these are some thoughts to leave you with here. Think about the health activities that are more important to continue post-pandemic and which tasks are not as necessary. So and celebrate your wins. So some of the things to consider is making sure you have a backup team, and Dr. Emily talked about having a team that work in bubbles so they don't cross mingle on their days that they work. And celebrate your wins. What went well? What strategies you will retain? So possibly for next flu season. So for us, the wins are the sneeze guards, which will probably bring in next flu season, scrubs for winter, so winter time, masks a bit more regularly for frontline staff, and we're hoping telehealth stays here as well. Next slide. So we're all part of a general practice collaborative, greater collective group. And so one of the ideas is making sure we're all part of a good medical neighborhood. So promoting the My Health Record, which helps to get results regarding pathology tests and COVID tests from to their regular doctor. So it's part of the respiratory clinics. These have been used to a great extent, which is great, but it's also there to reduce the risk to the GPs and the healthcare staff. It's also there to maximize the PPE. So it's really keeping us all safe, including the drive-through testing, which has reduced a lot of wait times across the state. Finally, I've got to thank the Allied PHN and SF Pathology and the Commonwealth and our teams that have tried to maintain a safe working environment for all of us as well. And thanks to the RACGP. Thank you.
So we thought we'd move to some questions, some Q&As, rather than be responding back. We thought it would be great to have some feedback from Prashiba as well around a number of these things. So we've had a few questions come in, and please feel free to post some extra questions as well, or particularly other areas that you would like us to cover. So we'll start off first of all, and put your questions in the Q&A box as well, then everyone can see your questions, and then we can put the answers in and answer them live. So we'll start first of all with the ones that went into the chat box. The first was around emails and whether emails are considered safe from a medical legal requirement. And so what's your approach to that, Prashiba?
So approach is, if you can do it safely, secure email is obviously the gold standard, but sometimes you do have to send a sick certificate or a pathology form. So if email is the easiest form for the GP, that is a consideration.
Thanks, Prashiba. And I know from talking with the chair of the RACGP, gosh, I can't think what their name, the electronic records group, their information technology, gosh, I'm having a mental blank. His advice certainly was that it was important to look at how we could expand into using email in a safe, considered way with patient consent. It wasn't a requirement to encrypt emails, provided the patient was consenting to the information that was being transferred in that process. And so certainly documenting that in the notes is really important from a legal requirement. We've had another question about sneeze guards in GP offices, and we saw those fabulous screens that you've got in your place at one of the clinics there, Prashiba, as well, and another clinic as well that was sent through. I don't know if you wanted to comment on how easy was that to install?
So Rob, my business partner, he went to Bunnings and got the acrylic screens, and it did take probably an hour or two to install them to the roof. But they were quite simple screen guards to install. And we do have it in one of the doctor's rooms as well. So if a doctor requests for it, we can use those screen guards. So they're quite easy to install and do it yourself. And you can purchase a lot of the gear at Bunnings as well.
Thank you. And temperature checks on arrival. So one of the things we still do in aged care facilities is a requirement to check temperatures on arrival for residents when they're having for visitors, for residents. And so one of those things is there any value in testing temperatures? And I apologise, I've got a vacuum cleaner next to me here. is there a requirement to check temperatures? And we brought this up actually with the evidence, and we talked about this here at SA Health. Was there any evidence? And there wasn't any actual evidence for checking temperatures. However, it is still in the aged care direction. And when we explored that further, why would we check temperatures when we know that fever is actually only in about 30 to 40% often of cases of COVID, because we know there's that range of symptoms. And it's because of the fact that it prompts someone, if they are feeling unwell, if they know they're going to have their temperature checked, it deters them from turning up to an aged care facility. And I would say, I think that's quite reasonable from a general practice perspective. If you can do that and you've got the infrastructure and the staffing capacity, then you could certainly check temperatures on arrival. But in terms of the evidence base, there wasn't an evidence base to undertake routine temperature checks, but it is something that is under, you know, I know a lot of GP clinics are doing. And Prashiba, what are you doing at your practice?
So the respiratory clinics, we do check temperatures for all the patients. At the GP clinics, we ask them the COVID questions around travel, around symptoms, but we don't do a temperature check. Could I just go back to the email question and update a bit more on that as well? So on our website, we have a download form for request for release of patient information. So the patient can download a release by email. So we do educate them. And so if they want to get any sick certificates or results, they can fill out that form as well.
That's an excellent idea, very innovative. Thanks, Prashiba. Now we'll move now to the next questions then on the Q&A box, and just a comment as well that did come through around the mental health and the explanation for change. And certainly we know that this is an ultra marathon that we're all engaged in this process. It's not a sprint. It's going to be a long time, unfortunately, going through COVID, and we're hopeful a vaccine will provide some opportunity and relief and hope for a number of people out there. But you're exactly right. It is very difficult to return to normal. So hence, it's the COVID safe, COVID ready practices. So I'll move now to the Q&A box. And first question we've got here is, what do you suggest for managing patients with hay fever in terms of screening prior to entering the surgery and attending appointments at the practice? Now, Julia, I am currently suffering from quite poor hay fever, having just bought a new puppy. Terrible timing to buy a puppy when you're working so busy at SA Health, but a beautiful little puppy. I've got terrible hay fever. What do you do? And this is something that has come up through here at SA Health. What are we going to do about hay fever? And it's a very good point. So it is a matter of screening and asking, is this an acute respiratory illness? You know, you've got the drippy nose, the sore eyes, all of those things, but it is just a matter of asking those questions. And telehealth would be an ideal opportunity, using telehealth before you see that patient in person. But if they are presenting with their routine hay fever and you're aware of that, then look, keep them 1.5 meters away from you. So they're not sneezing right on you, but certainly that's quite a reasonable thing for them to still come in and attend your practice if you know that that's part of their normal symptomology. But we don't want lots of people with hay fever turning up unnecessarily for swabs if they feel that that's part of their normal symptoms. The advice we've given out, if it's a first round of symptoms and they've just started getting a scratchy throat or something like that, and it's an acute phase, then we are suggesting they do have a swab. And then if it's settling into their normal symptoms with a normal COVID swab, a negative swab, then that's okay. So I hope that answered your questions. Prashiba, did you have anything you wanted to answer with that?
Yeah, so if you potentially, wary of a patient that might have hay fever symptoms, we do suggest to all the doctors to wear a mask. Just be on the safe side. It's a simple solution for us.
Excellent. Now, next question we have is, do you have any suggestions for the best way to see symptomatic patients in the car park? Maybe they're going to be near that RAA van that you had on there, Prashiba. And around, we've struggled with bringing exam equipment outside and safe disposal of PPE before re-entering the clinic. Any suggestions on that, Prashiba, that you've found with your practices?
So if you have a space available where you do have a room, you can, in a way, remove as much equipment from that room and bring the patients in safely, if you can do it. That way it's easier to clean that room. If you saw the respiratory clinics, we know that these are very symptomatic patients. So then we know that if anything becomes a positive case, we could clean that room. And if we need to remove any items, there's not many items in the room to remove, either clean. So if you do have a spare room, and I know not everyone has a spare room, potentially use that as a sick room or separate waiting area as well.
But that's just a good point about how you're gonna doff all your PPE as well. And we know that that is one of the biggest risk factors, is when you are doffing and you're taking off all your PPE, particularly the mask. And we've had some anecdotal comments around hair contamination of COVID. So it is really important thinking about how you would do that. Hopefully that you're not going to be having too much high risk exposure in your car park anyway. But when you are taking off, you do need to dispose into a bin that's got would have a pedal on it or something like that you could then roll it, take it off in the video way it's demonstrated on the SA Health website, and then put it into a bin that's ideally located near the door. So that would be something to think about. But then again, you don't want people touching that bin. So Prashiba's exactly right, thinking about extra space or where you can store that. Another question we've had through is around, what do you suggest for kids attending childcare who are presenting with ongoing runny noses and cough? How often do they need to be swabbed? Well, this has been something we've had long discussions about here at SA Health. Can they be seen safely at the practice? We have suggested that children with the slightest symptoms, as soon as they get the symptoms, they go get a swab. We know it's very accurate to get a nasal PCR test. As soon as they've got that negative result, they can then, when they're feeling better, they can then go back. But the advice still is that they should be swabbed before attending childcare. And I know people say, you've got no cases here, why are you doing that? But we know we are really still quite concerned. We're not in a state where we feel comfortable here with the eastern states and what's happening there, that we can just allow kids to attend childcare with no swab beforehand. So I hope that answers your question. Prashiba, any comments from you?
Not on that one, no.
And then we've had a great question around consent forms when around the patient signing to agree that the email is non-encrypted. So that aligns with what you were saying as well, Prashiba.
Yes, so you could potentially have on your website a sign-off sheet that they know that the emails are unsecure, and they accept that if it does get sent to the wrong person or doesn't get delivered properly, that it may be not the right thing to do.
And just on that as well, we've had another question come through around security required for sending emails. And if you did want to encrypt something, can you recommend any encryption products? I don't know if you've got any comments at all about that.
There are a few encryption products available. We find it hard that patients on the other end need to have a way to securely unencrypt it. And if they don't have the right product, they can have issues. And I'm not suggesting this as a way to do it, but potentially we know that WhatsApp is an end-to-end secure encryption model. Whether you want to use it or not, that is up to you, but that's just a suggestion. We don't use it, but again, that is supposed to be end-to-end encryption.
Thank you. And just in terms of with the emails as well, if you are going to send patient details, you need to get consent, but also consent for what the information is that you're going to transfer as well. And there was just a comment that came through around, can you send all sorts of things across. Look, you certainly can if the patient consents, but you need to document what you're actually sending over and that they're aware, so that it's something they're comfortable that potentially it could be intercepted. So I hope that answered your question there.
Yeah, and so if we limit it to certain things like sick certificates or pathology forms or radiology forms, those common forms that patients come and collect, then that's a fair way of reducing the risk as well.
Yep, perfect. And certainly SA Health, you can't send emails externally with patient details. Still in this day and age, it's not at that point. We don't have secure messaging between. So from a government perspective, you can't send information into the LHNs that then you'll get back via email at this point in time. All right, I think there's a thing. Hopefully that's answered all the questions around security that we've got here in our Q&A box. Just to follow up a little bit around, the next ones were about any staff having coughs, colds, sore throats, go home immediately and attend for a COVID swab, cannot return to work until receive a negative swab. Lots of staff leave now, causing problems with staffing. Is anyone else being as strict? I think that's an excellent question. We really should be strict that if you have a staff member with a cough, cold, sore throat, that they do go home immediately and get a COVID swab. We would encourage that for any workplace, not just in general practice. What are your thoughts on that, Prashiba?
We've had a lot of instances where staff have had to go and get COVID testing, and so it does have a drain on staffing. But if they do get a COVID test or if they do have symptoms, we do ask them to stay away from the practice.
Thank you. And I'm sorry, I missed one other question for consent. Was, do you need to consent for each email that you're sending out? What do you advise for that, Prashiva?
So with if you're going to send a lot of emails to the patient, we do suggest that having an email consent form that the patient would sign. So any communications from that moment on is they understand the risks around unsecure emails.
Perfect. For the average general practice, we are still screening patients and not seeing patients likely to have COVID. So in terms of that, are we still screening patients? Look, I mean, we are certainly still screening patients in the hospital sector, and I would still encourage that you are screening patients. And one of the key reasons for that is around that we are still seeing quite a number of essential travellers coming over. And a number of those essential travellers, as many of you have told me, rock up to your practices, walk on in and say, I'm here for my swab right at the front desk. So it is a good idea to think about how you can screen people, particularly if we do have clusters in the future and we're thinking about those particular people restricting their movements, for instance, that we would then know that they've attended the practice and asking those questions. So a good idea to still be screening, but of course we have transitioned quite a bit from those overseas questions back in March to where we are today, but I would still encourage it. Are you still routinely screening all your patients at your clinics, Prashiva?
Yes, we are. We're routinely screening them for all symptoms and for all the standard COVID questions as well around travel. That is part of the process for all. And if anyone's got any symptoms, then we do ask them to stay in their car and get the doctor to give them a call or the nurse to give them a call and ask further questions as well. And if they need to be brought back in, then potentially they've done a lot of the consult over the phone and then bringing them in for an examination.
Perfect.
Thank you.
Excellent. And don't forget to screen the visitors with them as well. I think we forget about the visitors. I think they're often one of the riskier ones is the visitors who often can be visiting from other places or from interstate. So what degree of community spread in the future would you recommend to close the doors and move totally to telehealth? Michael's posted that. Now that's a really good question. I mean, we certainly have a thought process around how we would increase restrictions in the state. And there was a great article in the Advertiser today by Chris McGowan, the CE here at SA Health, around what we would do in terms of future outbreaks and how we would increase restrictions. So when you are seeing in restrictions increase, Michael, and you're noticing that in fact we are moving to a change in our density rules, or we're closing and restricting our public spaces, then that is certainly the time when you would be strongly considering moving to a predominantly telehealth model with those infrequent face-to-face visits. And we've had a great question as well posted around Victoria and the learnings in Victoria as well, and what we would do, or what have we learned from GP practices in Victoria. And we have learned a lot. We've learned a lot about lack of PPE, for one. We've also learned that it's very important to involve general practice in COVID response. And we're very lucky that we have the GP assessment team, which is contracted through SA Health to provide care in our Medi Hotel model of care, but also for COVID positive patients in the community. And so we've learned from in Victoria with, first of all, that there was a lack of communication around how information was transferred out in terms of PPE usage and what to wear, but also around the inability to contact easily into their infectious diseases equivalent CDCB in Victoria to notify of positive patients. Now that is so much better. They've got an electronic notification email system now for their GPs in Victoria. So we're hearing more positive feedback, and certainly more PPE is coming in. But we have learned it is so important to engage general practice, because you, first of all, you know where the weak spots are in the community and patients that you worry about. And also you're going to be hearing that from your community, that you're noticing an increasing in symptoms, and you're the people, you're the gatekeepers to say, go and get a COVID test. It's really important. So thank you, Michael, for posting that. But yes, it will be around watching the directions and where they change in terms of restrictions coming in. All right, Paul. Paul's posted here, where does one purchase inline filters for spirometers, and how do they not affect the FEV1 FVC ratio reading if they're dense enough to catch infectious agents? What a good question, Paul. And I had wondered this myself as well a long time ago when this came out in May as a recommendation around disposable filters, and that you would take the filters out. We know that the particles wouldn't affect the readings. It was just around ensuring that you had a change in filter. And I think that advice is still current. I have no idea. Prashiba, do you have any idea around ordering inline filters?
So the inline filters depends on the model of the spirometry you have. So you can speak to your medical supplies company and they should be able to source it or find out more about it. One of the suggestions is if you are going to do spirometry in the clinic, make sure the nurses or whoever is conducting the test, they have scrubs and face mask and a mask on as well, preferably an N95.
Perfect. Now, next question here around, we have patients where childcare attendees have had the symptoms for 3 to 4 weeks and parents don't want to swab them again, but we are hesitant to see them in person as concerned they have a new infection rather than the same infection still causing symptoms. Now, I've certainly heard of this. A number of GPs have contacted me and said, what do we do in these situations where we have someone who's had the swab, it's come back negative, and they've still got ongoing symptoms, and they've told me that they've seen the patients coming, they've come into the room and they've worn a mask and they've put a mask on the patient. It's a little bit hard on a 2-year-old to wear a mask. I wouldn't be suggesting that often because it gets ripped off and then you probably spread the virus even further. But we've said that that's quite reasonable if they do have a negative swab and it's the same viral illness. It gets tough though, doesn't it, after 3 to 4 weeks, particularly if they've still got a cough and they're going to go back to childcare. But we do know that we've said to childcare facilities that if they have the negative swab initially, then they're okay to go back. So we would say the same would apply for general practice, but that's really up to you in terms of how you have your respiratory clinic structured, or your particular staff person for the day who's going to be there, your GP for the day who's going to be there. And Prashiba, you had those great examples of how you split up different people.
That's right. So you have a sick doctor that will see any of the sick children as well. And so they have the proper PPE and proper equipment. Again, making sure that if you want the kids to wear a mask, you potentially could buy things like Spider-Man masks. I'll call it a Spider-Man mask or something and give the kids the mask to wear. So it becomes a bit of a toy to them.
Thank you. Now, do you dispose of your PPE into clinical waste? Is sealed and bagged PPE able to be disposed of into normal bins?
So, yeah, go on.
I don't know, go.
So, yeah, so all PPE for us, especially at the respiratory clinic, is into the clinical waste bins and get destroyed. As long as you have clear those clinical waste bins in your practice, you can or have a bin that you could doff off your gear and then seal it and put it into your clinical waste bin. That's my suggestion.
Thank you. Now I'm just conscious, well, have I covered enough for the NT? So if there's anyone from the NT, I can see, Chris, that you're there on the chat box. But if I haven't covered things in the NT, please post them in and we'll try and cover them off as well. I'm conscious that I did try and focus on the NT, but it seemed to rush over very quickly with your restrictions. So Chris, you posted around, do you think all the clinic staff should have the COVID app on their phone? Look, we should all have the COVID app on our phone, and SA has had one of the best responses for downloading the COVID app, but it has not been particularly useful, unfortunately. But we do have the capabilities here in SA and also the Northern Territory that if you did have an outbreak and you want to trace, the COVID app would be really helpful. Unfortunately, it hasn't been helpful with our cases here, but it could be very helpful for if you have someone coming into your practice or one of your staff members. So I would suggest that, and I know Prashiba, you had that in your slides as well.
That's right. So you could suggest it to staff that it's a good idea, and patients as well, to have a COVID safe app. And I guess if there is any situation that we might need it, hopefully it will become a useful tool to have. Thank you.
Perfect. Sorry, I'm talking too much and coughing, but not drinking enough water. I don't need a COVID swab. I promise. I'm just dehydrated with my empty water glass. Now, if wearing scrubs, are you washing them on site? Prashiba, are you wearing scrubs at your practice? It looked like it.
Yeah, so a couple of the practices, the staff do wear it. Some of them wear some clothes and come in and change into their scrubs, but at the GP clinics, and then take their scrubs home and wash it at home. At the respiratory clinic, everything stays inside. So there is a washing machine on site. So at the end of their shift, they all put their scrubs into the washing machine and it gets washed overnight. Someone puts it out to dry. We just don't iron it for the staff.
Excellent. Now we're coming right to the end of time here, and 60 degrees. Don't forget 60 degrees for your scrubs. We're coming right to the end of time here. There was just a final one about managing flow of patients who state they have symptoms but they don't have a car to wait in, and or a patient has respiratory symptoms that comes in with another issue such as an ECG. And we've certainly discussed around previously in other webinars around making sure that if you do have to see someone and you do need to provide care, PPE for yourself, PPE for the patient where possible. And Michael, you've posted as well around PPE gowns, still difficult to source. And I can say that we certainly obtain them through SA Health, but I don't know whether, Prashiba, you had any ideas as well.
Yeah, we sourced it through a few different sources. So early on, a group of practices got together and led by Dr. Alvin Chua, we sourced a lot of gowns. In the last couple of months, we've actually got a lot of gowns from SA Health through their procurement area. That could be a suggestion to get in contact with SA Health and ask if they have any gowns that they sell it to the practices.
Yes, and we do certainly have gowns available there, so you can certainly email through Michael, that's fine. All right, well, we've come to the end, and I'm just so grateful to have, this was Prashiba's idea to present this webinar. I think you'd thought of all these fabulous things that you'd done in your practices, and you'd seen others do as well, and Prashiba now as part of our education and training committee is just so wonderful to have you on board as an excellent practice, as a practice manager, director, and all of those roles that you do. So thank you so much, Prashiba. Thank you so much, Elaine, as well from the RACGP for hosting tonight, and also for the questions. Please feel free, if we haven't answered something for you, please feel free to send that through to the RACGP and we can try and answer that for you. So thank you so much.
Thank you. Good night.